Good afternoon. You're watching L+A Now with Barry and Jenny. I am Jenny Nagel.
I'm Barry Eichner, and welcome to another rather advanced webisode of L&A Now. We're really excited because, as you know, we're like diving deep into medical aesthetics, and we see that the industry is really going in that direction. And so giving estheticians the ability to perform more advanced treatments is something that we're really excited about. And so today we have Jason Dodd, who is you're the education manager for EpiStep, right, Jason?
I am.
Why don't you introduce yourself and let everyone know who you are, what you do? You've got so much on your resume and such a thriving business. I'd really love for people to get to know you a little bit.
Awesome. Thank you. Thank you for having me today. I really appreciate it. So my name's Jason Dobb. I am a licensed esthetician. I have been in this amazing industry for 20 years now. And I am not only the director of education for EpiStep and Vivari companies, but I am also a spa owner. So I am in my spa treatment room 4 to 5 days a week, working every day, using these treatments, these advanced modalities, and getting amazing results. So I love that I'm actually still in the treatment room and able to use these modalities and try them out on my clients and get these great results.
Jason, one of my favorite things is that you're located in California, and that is a
Yes,
state where there is not much allowed, and
yes.
microneedling is one of the things that is not allowed. And so, what I love is that you being sort of behind the scenes with EpiStep, you put together a way to bring that change to the skin without overstepping, your state guidelines of what you can and can't do in your state, and you're getting some amazing results. So I just love this is my favorite part about having these is when we have someone from the brand that's utilizing this hands-on in the treatment room on a regular basis because it puts a different perspective on it so that you guys can ask questions and say, well, how many did you do? And how many of this did you do? And what way did you do it? So I hope you guys really take advantage of that today as picking Jason's brain.
Please. That's what I'm here for.
And so, Jace, before we get started, we generally go through a little bit of housekeeping tips. So, I'm going to shoot it over to Jen, and she's going to talk about chat versus Q&A.
All right, you guys, there are some rules here today, okay? Have fun, of course. Ask all the questions you want. Put all the questions that you want in the Q&A. And we ask you to do this so in the event that we don't get to a question, we run out of time, anything like that, we can pull that report that'll have your name, your email, and we can send that to Jason so he will be able to thoroughly answer any questions that you have. But the chat, look, we've already got Sue in the chat who knows
I'm
what
laughing because
happens.
they all know.
She knows what happens in the chat, and the chat's where the fun's at. So, Barry, what should they put in the chat?
All right, so the chat, so it's sort of like a mullet where it's business in the front, that's Q&A, and party in the back, that's the chat. So in the chat, you're going to put things like, Jason, I love those glasses. In fact, if you didn't have those glasses on, I would probably think, what's different about Jason? Um, and it's also where we start our roll call. And people are already starting it before we even got into it. So we usually ask people, if you're just joining us, I'm seeing more people come in. We are spending the next hour with Jason Dodd, who is the Director of Education for EpiStep, talking about non-invasive scar revision treatments. Jason just chimed in. He's in California. It's happening so quickly in New Jersey. I'm in Fort Lauderdale.
Sue, Kim, and the other Kim. I am also snowed in. I am in New Jersey, and we're staying warm together. So I like the camaraderie that's going to happen in this chat. Okay, ladies?
I was wondering if the amount of people snowed in today was going to bring numbers down because I'm thinking to myself, all of my friends back in the day when it was a snow day and we didn't have to go to work or we had off from school or whatever in college, it was a day to sort of imbibe and have a little bit of fun. Jen, how about yourself?
Well, my son's having fun, I'll tell you that much. In between snow breaks, snow shoveling breaks, I have been in and out trying to work, but the kids are enjoying it to the fullest. In fact, I think I just got another phone call saying school's canceled tomorrow as well. So,
Oh no.
Brentwood's in the house. Hi,
Florida's in the
Brentwood.
house.
No,
Uh,
when you said Brentwood, I was thinking a part of LA. I'm glad you. And then Kim is. Oh, hi, Kim. Yes, yes, yes. She loves us. Thank you, Kim. We appreciate you. Okay, so we've discussed chat. Do we have the chat opened up, Jen?
the chat is opened up. So you guys make sure your setting is on where you can chat with everyone,
Everyone.
unless you have a
Yeah.
specific comment you want to share. But you can open that up to everyone so we can all join in on the conversation. Q&A is for the questions that you'd like Jason to answer. And something exciting, if this is your first webinar of 2026 with us, I just want to remind you guys that we've switched gears with our recordings. So historically, they have all been recorded. You will get access to this recording in 24 hours. That has not changed. You will be able to watch that recording for 7 days. But after that, we wait 30 days, and historically we used to put it on our mobile app. But now we have all of our webinars available on L+A on the website. So you guys can just go to education and drop down, and you'll see webinars on the on-demand library. And you can uncover so many hours of education. In fact, I'm pretty sure the EpiStep webinar we did last year with Jennifer should be available on there. So this will be on next month in March.
Awesome. And the thing I'm really excited about is we were talking in the green room with Jason. I've had the EpiStep treatment multiple times. It's called the EpiFusion facial. And the treatment heads all have various and sundry ingredients infused into them, except for the performance head, which is just the hyaluronic acid spheres. Um, but the thing that I love is that he's going to talk about outside of the box uses of the device and combine it with other exfoliation modalities to really amp up your treatments. And as the industry continues its massive flux into more clinical and more medical level focuses, um, estheticians who aren't under a medical director need these types of treatments in order to maintain the ability to provide the level of results that these medical offices can. And you know, it's interesting, Jenny, I just had this. So there's a doctor that we follow. We met him at the Medical Spa Show by AmSpa last year. He posted today that the United States has the same number of medical spas as it does McDonald's.
Wow.
So if that's not indicating that the industry has shifted, there's really nothing that you can say then. So pay attention. If you're watching this on the website after March of 2026, you can feel free to share this with people. The links will be there to share it. The more people that learn about this treatment and the more people that learn how they can really impact skin without having a medical director, chef's kiss. So,
Mhm.
Jace, if you want to start sharing your screen, we'll let you take over.
Sounds good. Thank you.
You got it, Jace. We can see everything.
Perfect. All right. So this is again, we're talking about EpiFusion non-invasive scar reduction. So I'm super happy that you're all here. Thank you for joining us. And Barry already let me introduce myself, but my name's Jason again, and I'm the Director of Education for Vivari Corp, which is the parent company to EpiStep. And we also carry Dr. Grandel, which is a German skincare line. And for those of you that have never seen our device, this is it right here. And it is quite a compact device that allows you to travel with this device. I travel with it obviously for education purposes, but this is just a little taste of what our device looks like. It is very tabletop. It's very small. It's compact, but it's a powerhouse when it comes to performing these treatments. And so this is the handle, and these are the tips with a little video to show you what the tips do with that tapping motion. That tapping motion is what gives you the results. And so this is just a really quick little intro to the device. Very easy to turn on and turn off. Turn on the main power from the back. There's an on and off button on the front. And then you have 5 different settings for power. So it goes all the way up to a 5, which some people can't handle, but for the most part, everyone handles it just perfectly. But we always have those settings where we can kind of tone it down as well if clients need us to tone it down. We're best known for these pillars here at EpiStep. So no pain, no downtime, no bleeding, no needles, completely non-invasive. And these are results that your client can see immediately and they see long term. And that's why the clients really love this is when they leave, just having the treatment done, they will love the results that they achieve right then and there. But they will love the results even more because they are compounded. Every time they get one of these facials, the results keep getting better and better and better. And today we're going to talk about scar reduction, but this also works for wrinkles, it works for hyperpigmentation, it works for so many other things besides scar reduction. But today we're focusing on scar reduction because that's my favorite thing to do with this device and with these tips. As Barry mentioned, we do have three different tips currently that we use with the EpiStep device. We have a hydrate tip, which is made purely out of hyaluronic acid. We have a brightening tip, which is hyaluronic plus vitamin C, and we use an ascorbyl version of vitamin C, so not the L-ascorbic acid, but ascorbyl glucoside. And then we have our performance tip, which is truly my favorite tip. It gives you the best heavy duty results, I call it. And so I reach for this more than the other two tips myself, but I do use the other tips in treatment as well. Our tips are zero fragrance, zero alcohol, and zero preservatives. And I want to talk a little bit more about the technology behind the tips because it is proprietary to our company. So the very cool thing about our hyaluronic pyramids is that you can see here the pyramid structure under a microscope to show you the shape of the pyramid. So the tip or the pyramid, as we call it. On that little itty bitty patch that fits on top of the EpiStep device, you have 850 micropyramids made out of sodium hyaluronate on a 2 millimeter diameter patch. The nice thing about the 2 millimeter diameter is that it covers a lot more area. So you're not having, if you think of microneedling, you've ever microneedle before, the tip is very small. You're having to do your cross hatching and going back and forth. With this one, it's just a stamping motion, and that 2 millimeter tip is able to cover a lot more area in a shorter amount of time, decreasing your treatment time. Each one of the pyramids is 0.25 millimeters long. So we all know that 0.25 it tends to be the magic number in our industry for like safety and efficacy and all the other regulations. So 0.25 is the key thing there. And then each of the hyaluronic pyramids contains 37 milligrams of sodium hyaluronate, which does get melted into the skin if you use one of the hyaluronic pyramids. So these are our hydrate and brightening tips. And essentially, you would dry channel with these and then go back and add our hyaluron serum. And then when the hyaluron serum is on the face, you would glide these tips over the face, and then those pyramids will melt into the skin, delivering 37 milligrams additionally of hyaluronic. And then we go back to our PLA pyramids. So these are our performance tips. These are the polylactic acid. Again, same on a 2 millimeter diameter patch. Each one is 0.25 millimeters long, used for microchanneling, infusion, scars, stretch marks, and many other things. I love doing like a really good pore treatment. If someone has enlarged pores, this is a really great treatment to infuse any kind of pore reduction serums. And it's so many other uses, but I do love this tip. I reach for it the most. It is my favorite. And just a little bit more about polylactic acid. So PLA or polylactic acid is a biodegradable plastic that's made from natural resources like cornstarch or sugarcane. Its production involves fermentation of these resources to produce the lactic acid, which is then polymerized to form the PLA. So PLA or polylactic is used in many different things. You may know it the best for filler injectables. A lot of filler companies use polylactic acid as their filler. And so that is one of the prime reasons why we use polylactic acid in medical aesthetics is for filler. But they're also using it now for tissue engineering. So for burn victims, scars, all those things, polylactic can be a good substitute that helps to regenerate tissue. And then collagen induction, of course, for us. So we're inducing that new collagen in that synthesis in the skin. And so we love using it for that reason. Again, no pain, no downtime, just results. And then this is a little deep dive into our proprietary technology that we use to make the tips and just to show you size differences and shapes. So we are the only company on the market that's able to laser drill layers with different thicknesses or structures in one micro hole. So we have a technology that allows laser drilling, and that's what allows us to make the stamps so fine and to incorporate so many different tips, 850 of those little pyramids on one tip. And so we can do minimum hole sizes down to 2.5 nanometers and thicknesses from 25 to 50. micrometers. And so on the side here, we have just a little chart just to show you the differences in a virus, a bacteria, a blood cell, hair, and needles, and how fine they are, just to show you how fine and how small our tips are. And on top of that, we have the technology to put up to 8,000 micro holes into a 4 millimeter by 4 millimeter area, similar size to a pearl or a bead. So when you're thinking of doing the stamping on just a 4 millimeter by 4 millimeter area, the size of a small pea or a pearl or a bead, we can do 8,000 microchannels just in that one area using this technology with the laser drilling. And so I think this is really cool to show you on the top there. If you've ever done the microdart patches on your lips or under your eyes or on your cheeks, that first picture is the laser drilling for those. And then we go on to another technology where it's very wide of a laser drill. And so it kind of uh, makes it so that way we don't penetrate too deeply. And then the third laser drilling that we do over here on the side, on the right-hand side, is to show you a smaller shape where it can penetrate a little bit deeper into the skin. So this is great to control penetration and product depth as well. So this is a very cool technology that is proprietary to us to create those tips. We did a fun little study. I love science. I'm nerdy when it comes to science. And so we did a really cool penetration study just to show you how our tips can increase product infiltration. And so for our study here, we had a control with no treatment, of course, as always, when you do any kind of study, you want to control with no treatment. And then we actually took or had our science team take the tip and put it on their fingertips and actually press it into the skin. So actually doing a hand tapping motion just to see if we were able to accomplish the same results by doing a hand tapping motion. And it's very hard to see, probably on your screens, especially if you're on your phones, but there is a very small indent on this hand treatment right here in the center. Just very, very small, getting into the skin, but only one small little indentation into the skin. And then when we actually attach the tip onto the EpiStep device and doing the actual tapping treatment, you can see here on the right-hand side with the yellow arrows, those channels are much larger by doing that tapping treatment, and you get more of those channels as well, which allows for more product penetration. So as estheticians, we always talk about how we use the pores as our entryway into the skin and then working through the intracellular cement and dead skin cells. And so I like to think of the EpiStep as an express elevator. This is creating these express elevator channels down into the deeper layers of your skin to deliver those active ingredients quicker and more efficiently. So that way we're not having to work through the pores, we're working with the pores and then not having to worry about the intracellular cement, dead skin cells. This is just creating an immediate channel right into those deeper layers of the skin to allow those products to penetrate. So for this study, we ended up using fluorescent material. We added fluorescence to a water-based serum, and then we applied it onto the serum after doing the hand treatment with the control and with the tapping treatment. And that is this next slide here, which essentially shows you 1, 2, and 3. So we had our control, no treatment whatsoever. So that's just smearing that fluorescent material on the skin to see how well it penetrates. And then the second one is going to be the EpiPens without the tapping motion. And so that's again the hand treatment right here, just to show you it's not going to penetrate as well as number 3, which is the actual tapping treatment, creating multiple channels and allowing that product to really truly penetrate into the skin deeper. And these results are after 4 hours of treatment. So this is just showing you that you really are able to get that deeper product penetration just by using that tapping motion with the device. So why this technology works? Why does it work on scar tissue? Why does it work on the revision of the scars? And that's the most important thing, is that microchanneling at its core improves scarring by creating controlled microinjuries that trigger collagen remodeling. They break down rigid scar tissue and they replace it with more organized, healthier skin cells. So our tips use those ultrafine pyramids to stamp uniform channels into the epidermis through the stratum corneum to allow those actives to easily access the basal layer. This process creates thousands of those precise microinjuries per treatment, which allows again for more product penetration. And we're going to talk more about that in a second when it comes to combining this with other modalities, chemical peels. So after that, the skin then treats each channel as a wound, which activates the wound healing cascade and collagen induction, as well as elastin synthesis. And if we know anything about scars, we really want to break them down to build them back up, to get that new healthy skin, that new elastin, that new collagen, bringing those healthier cells to the surface and giving us a smoother surface to work with our clients. So, as I mentioned, scarred skin contains disorganized collagen bundles, and they're often tethered atrophic depressions. So, those are all your different scar tissue types where we have those depressions into the skin. So, repeated microinjury helps break those down and some of the dense abnormal tissue and stimulates replacement with more orderly collagen again. And as new collagen fills in those atrophic areas, the dermis thickens and the texture becomes more level, so scars look shallower and smoother over time. And again, each treatment is going to give you better results. So we want to compound all those results time after time after time. The inflammatory response, which is very minimal, also supports remodeling of excess collagen in those raised scars, gradually softening firmness and improving flexibility through hypertrophic or keloid scars, which are notorious to treat and notoriously difficult to treat. But they often those type of scars often require combined modalities such as chemical peels, which is my favorite thing to use with this product, in order to get those results for those hard to deal with scars. So for complementary therapies, we recommend that temporary channels dramatically enhance penetration of growth factor, peptide, and stem cell-based serums, which are applied immediately after stamping to drive regenerative signals deeper into the skin. And so we do have our EpiEssence peptide serum, which we highly recommend using with this device, regardless of whether skincare lines you use. And that's the beauty of this device, is that you can use this with what you already have in your treatment room. But we do have a couple products that we specifically recommend using with this in order to get the best results. So our EpiEssence peptide serum contains 12 peptides, which help to brighten, repair, firm, smooth, and protect the skin. And I'll talk about this later and how you can incorporate this into a complete facial treatment with the EpiStep and a chemical peel and get your best results. But this is one of our complementary therapies that we do recommend using with the EpiStep in order to get those best results, because those 12 peptides all do different things in order to improve the skin. I put a little example protocol here in order to give you an idea of what a protocol would look like with this. And again, I didn't put any specific skincare things in here except for our skincare that we recommend that you use with it, but you can do any kind of double cleanse. I love a good double cleanse. I love Korean skincare. So double cleansing your client just to prep their skin. And then if you want to incorporate LED therapy, which I always do when I'm doing scar reduction, I have a Soluma panel, I have a light stim panel, and I use those in my treatment room as a pre-process for this treatment. Oh, Jenny's coming on.
I'm so glad you're going to talk about that, because I noticed that you have it as the first step versus the end. Can you talk a little bit about that?
Yeah, so I've learned a lot of different things along the way about using LED therapy and how to use it when you're incorporating a chemical peel. And so for myself and what I've learned personally, I like to use LED as a preconditioner as to not reactivate the chemical peel or aggravate the skin more. So chemical peels, of course, they have acids in them, so they're going to break things down a little bit. And so if the chemical peel is still active, or anything like that, it just reduces, by doing the LED first, it reduces the risk of having any kind of, I guess, excess downtime or damage that could be done to the skin. And so I think of it as kickstarting the process by preconditioning the skin and getting it ready for this treatment. What
I
I
love
do
that.
recommend, yeah, thank you. What I do recommend is obviously having the client have an LED mask at home. And so 24 hours after this treatment, being able to retail them an LED mask at home and to continue the process at home 24 hours after this has all done its thing, highly recommend. I would love for
It's
your client to have that.
That 100%. And that's the same thought process of having. So I have a quick story. I have a friend who she was going in for, it was a friend of a friend going in for a facelift, like a half facelift or a mini facelift. And she said, "Hey, is this a good LED mask to get? We're talking about LED." And I said, "Yeah, have her make sure she's starting to use it now." And her surgery appointment wasn't for like 6 weeks. And she's like, "What? It's not for 6 weeks." And I said, "Do you understand that the healthier and the better condition that your skin is in prior to any treatment, whether it be an EpiPen, chemical peel treatment, or a facelift, you've got to get it in prime condition before you go in with these attacks, quote unquote, so that the skin can respond appropriately." So my second question for you then, Jason, is how long do you leave that on when you do it before? Is it the same 30-minute goal?
Yep. And so I try to, and it really it has to do with the client and their time and like what they're wanting to book. But with my treatment, it's an hour and a half.
Okay.
So it's a 90-minute treatment, which allows for the 15 to 30 minutes of treatment time with the LED as the preconditioner,
Mhm.
which I think is ample amount of time that once you get past that 15 to 30 minutes, depending on what panel you're using, or I know that there are some panels on the market now that have 5-minute treatment times, which is, I mean, that's amazing that we have that ability. But whatever your treatment time is, you can figure it out to incorporate the rest of the treatment. But for me, 15 to 30 minutes of LED pre-therapy and then moving into the rest of the steps is perfect for a 90-minute facial.
Fine. Perfect. Thank you for chatting about that.
Of course, my pleasure. So yes, again, and clients love LED. I mean, I don't think I have a single client in my repertoire that doesn't like LED. I know that sometimes it can be harsh to start, and then they get relaxed and they get used to it. And it has so many other, I think, positive effects on the skin and other things. But so yeah, I like to pre-treat with LED just to make sure that I'm minimizing any kind of irritation or redness or erythema or anything that could go along with this treatment. So I precondition the skin with LED light therapy, and then I use my favorite toner, depending on the client. At this point, you can do an enzyme or pre-peel if it's appropriate for your client, and you know your client's skin best. And so I like to use a creamy enzyme as a pre-treatment here, something that's very gentle, but that's going to start the process of just helping to digest those dead skin cells, essentially warming the skin up to the treatment that's about to happen. But again, it has to be done knowing that if it's appropriate for your client's skin, especially if we're going to move into that chemical peel next. So I use, again, just a creamy, very gentle, mild enzyme, take it off with a towel, and then I go into our self-neutralizing chemical peel. So self-neutralizing, I think, is the most important part of this. If you're going to use a chemical peel, to make sure that it does, quote unquote, turn itself off, to make sure that we're, again, minimizing any kind of damage that could be done. And especially we're going to be stamping this in afterwards. So we really want to make sure that if that chemical peel is penetrating deeper into the skin, that we're making sure that it's going to turn itself off, again, to minimize any kind of damage. And I'll talk about this in a little bit, but I love using the Linder Health peels. It's the one that I reach for the most because it has three very easy formulas to use that are based off of your client's needs, and they are self-neutralizing, and they work with other skincare lines as well. They have their own beautiful skincare line, but they work with other skincare lines as well. So at this point is when I would do the self-neutralizing chemical peel with the Linder Health peels. In particular, you can do up to 6 layers. Again, has to do with your clients, how they interpret the peel and what their skin is doing while you're applying their chemical peel. So we're looking for all those signs to stop. And so you know your client's skin best. I know which clients can handle 6 layers. I know which clients can handle 3 layers. I know which clients can handle 1 layer of these chemical peels, and they still get those amazing results. But it just has to do with knowing your client's skin the best and giving them the appropriate amount of layers. And if you're using other chemical peels, we can talk about that too, how to walk you through that. But the neutralizing is really important to make sure that we're going to be doing that stamping afterwards. We want to make sure that we neutralize those acids and turn them off in the appropriate amount of time. So then we would do the EpiStep treatment with a performance tip. And those performance tips do not melt. They stay solid. And so we're going to essentially stamp on top of that chemical peel after that chemical peel has been applied. And that's going to allow that chemical peel to truly penetrate better into the skin, especially if we're talking about scar reduction. We want that chemical peel, those multi-acids, to be able to penetrate into that scar tissue to allow it to break down that scar tissue to build up new healthy scar tissue or new healthy skin cells, not scar tissue. But we want to break that scar tissue down. And then for us, here you could apply your appropriate serums, anything that works well with the chemical peel that's not going to reactivate it or anything like that. But for us, we're going to use the Epi Essence peptides at this step. For me, it works well for everyone. It works well for wrinkles. It works for hyperpigmentation. It works for scar tissue. It works for all sorts of pore issues as well. And so I love applying that serum at this step. And then we have our Epi mask, which we are really renowned for. People in this industry love this mask, and I think that's great how much they love it because I hear about it wherever I go. People, even if they haven't heard about the device, some people have heard about the Epi mask, which I think is great. It is a Korean formula, and it does have a neck mask, which I think is great that we have a neck and décolleté mask that comes with it. So not only do you have your face mask, you have your neck and décolleté taken care of as well. And then for your client comfort, we actually include this gold sheet mask that you see here on the left-hand side. That goes on top of the epi mask with the gold side facing down on the client's skin. And that allows the body heat to actually radiate back and forth to keep the warmth in the mask, because we all know like sheet masks can be cold and they can be uncomfortable when you put them on, especially if they're sitting for a longer amount of time. So the gold mask that we have actually allows the body heat to radiate back and forth in the skin, keeping the skin at a warm, comfortable temperature, but also helping with product penetration. So that way those ingredients that are in the epi mask can penetrate better. And so that has collagen, hyaluronic, ceramides, peptides in the mask as well. And there is so much serum in this mask that what I love to do is after I apply the mask, I take the envelope and I actually squeeze it out into a bowl. And then I take a nice big fluffy brush and then I will paint on the neck and décolleté and then the arms and the backs of the hands to get all that beautiful essence that's in that mask on. And while that mask is sitting on, I will do a nice hand and arm and then a neck and décolleté massage for my client as just an extra pampering step for them while that mask is doing its job. And so I think that's a really great thing that you can do. Or a lot of our accounts will actually squeeze that out into a bowl and then they will decant that into a little 1 ounce bottle that the client can take home with them for aftercare. And that's a great way to introduce all of our products to your clients to be able to take them home because we do retail the masks. We do retail our hyaluron serum and we do retail our Epi Essence to our account so they can send those home with their clients. And we do recommend at least sending them home with the peptides for post care. But the hyaluron and the peptides combined together afterwards are just a powerhouse combo to help with the aftercare after having this treatment done. And so again, after that epi mask, take that off, rub the remaining serum into the skin or use a device. You can use cryo at this point, which is really good. People love cryo. They love the cooling sensation. Whatever helps with product penetration and cooling and calming the skin down, getting all that rest of the essence back massaged into the skin, and then following up with moisturizer and sunscreen. So this is your quick between 60 and 90-minute treatment time, I would say. At least allow 60 minutes for this treatment, but upwards of 90, especially if you're doing a little bit more of the extra fluffing for getting that serum back onto the skin, massaging the skin if you're doing any kind of neck and décolleté treatment with it, however you want to do it. I can also help you come up with protocols based on what you have and how much treatment time that you want to offer to your client. This treatment can be repeated every week if appropriate, or every 2 weeks to a month. It's really up to you again in knowing your client's skin and being able to give them what they need. But with the Linder Health peels, you can technically do the peel every week. And so it's really one of those things where, again, just know your client's skin and you are the esthetician. You are the mastermind. You are the one that knows them the best. And so give them the treatment that their skin is going to love. These are some before and afters from my treatment room. And then I have one that I'm going to share at the end that is from another one of our accounts that did some scar revision as well. So this patient here received 3 EpiStep treatments using a combination of the performance tip with the Linder Health Hero Peel and LED light therapy. Excuse me. Home care for him, he was already on some home care from Lyra Clinical, which I absolutely loved what he was using. I use Lyra Clinical in my treatment room as well. And so having him already on that home care when he came to see me, I was like, this is perfect. I don't have to worry about anything. You're on great home care. The only thing that I changed was that I added in the Epi Essence peptides and the hyaluron to his home care just to get him those amazing aftercare results. And so again, this is after 3 EpiStep treatments and a hero peel incorporated with the LED. Beautiful results. We're still working together to get him even better results. This patient of mine received 5 EpiStep treatments using a combination of the performance tip with the Linder Health Hero Peel and LED light therapy. And what I really like to call out here is not only the difference in the depth of the scars on this patient's face, but PIE. And if you're an esthetician, you know what PIE is, that post-inflammatory erythema. It is typically very difficult to treat. And so I was really, really happy with this client that, again, we got the scar revision going on, but to be able to treat his PIE and brighten that at the same time was, to me, chef's kiss. Home care here, as Barry mentioned earlier, Lilac and Flint is one of my favorite brands that I love working with. So for this client, we love Lilac and Flint. He loves using the Lilac and Flint products because they're simple and easy to use. And they got him these amazing home care results as well. And then we paired it again with the Epi Essence peptides and the hyaluron just to get him those treatment results at home again. One last one from my treatment room. So this patient had some very deep scarring, box pick scarring, ice pick scarring. This patient got 6 EpiStep treatments. Excuse me. Again, using the performance tip with the Linder Health Hero Peel and the LED light therapy. This patient also used lilac and flint for their home care, combining it with the Epi-Essence peptides and the hyaluron. And we're still working together as well to not only treat more of the scarring, but also some hyperpigmentation and some fine line and wrinkle concerns, which you can treat all at the same time. And then from one of our other accounts, the Beauty Loft in Lee Summit, Missouri. So her client was coming in for a combination of scarring and for hyperpigmentation. And she got some beautiful results with 5 EpiStep treatments using the performance tip and using our home care. I'm not sure exactly what the rest of her home care protocol was for this one in particular, but she was able to get some really beautiful before and afters regarding the scarring and the hyperpigmentation with this client's concerns. And that's all I have. That felt like it went by really fast, but this is me. Please take a screenshot. If you want to get in contact, please take a screenshot of that. We do have a really beautiful Facebook group. We have a really awesome Instagram. We have an amazing YouTube where you can see treatment protocols. And yeah, we love chatting. We love helping estheticians succeed and achieve really incredible results in the treatment room. So I'm really proud of that.
And Jason, my favorite part is that you can use this with any skincare line that you are comfortable with.
Mhm.
So we have the luxury at Lipgloss and Aftershave of incorporating the EpiStep into a ton of different skincare protocols. And there is not one that we haven't seen amazing results. I post before and afters all the time on our Instagram stories. In fact, I just did one with the Mr. Lulu skincare brand. I
Yes.
did not do the performance tip with the peel, but I did it in conjunction as part of the treatment with the hydrating tip.
Hmm.
So you guys, there are so many ways to do this. And I want to just make sure that everyone that's on today seems like they're very familiar with EpiStep. But if anyone, and you guys have a few minutes to answer this in the chat, if anyone is like, wait a minute, let's talk about the other tips, please let us know. But I know we've got some questions and comments about the performance tip. So let me know if you guys need a little more information on how to use the other tips, and I'll have Jason go over those. Um, but we did have, so Johanna asked, when you're using the pen, do you typically use a horizontal and vertical hand motion or circular or both?
Essentially the way that I do it is I work in what I call the microdermabrasion movements that we learned in school. And so I think of the middle, drawing the line down here. I start in the forehead and I work my way over, 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 down, 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 and then from the inside out, inside out, inside out, and then up along the jawline, drawing it up. So, and then you get your, obviously not me for my chin, but down the chin here. And then I always get the nose afterwards. One of my concerns is pores, and so I always make sure that I get my nose. So it is a stamping motion, Jana, and so it does this very much this up and down motion where you don't have to worry about gliding it along the skin, but you're just doing this up and down patting motion, and it's very gentle. That's the hardest part for estheticians to learn is they want to really press this device into the skin and kind of try to like really push it in. You don't need that pressure to get the results, and that's the beautiful thing. And the device will actually tell you if you're pressing too hard. It will give you some feedback, some auditory feedback to let you know
Oh,
that you're
really?
pressing too hard. Yeah.
Oh, I've never heard that. I guess I've never pressed too hard. That's interesting. What does it just like beep or how does?
Um, it makes this loud grinding noise, which means that
Oh,
the device is actually being pressed too hard against the skin, and so you can actually hear it making this like really awful grinding noise, essentially, is the best way to describe it. So the pressure that you need is very light and gentle. You don't need a lot of pressure. One of the advanced modalities that we do, though, however, is we take the performance tip and we actually press it into the skin and do a slight little twisting motion while it's on the skin. That really helps to break up some of those, so the advanced scar tissue as well. So just a small like indentation and twisting. But again, whatever's comfortable for you as far as how you move it along the face. But again, I move outwards, upwards, here, and then nose, and then chin, and a little bit
I
of
have
overlapping.
I have some questions.
Yes.
Um, Jay, you're the director of education. I'm wondering, Does EpiStep have a structured like training program for, let's say, for example, someone buys the device,
Mhm.
and when they receive the device, is there something that's structured with you all to get them trained on the device?
It's me. You get me. So
And
we do a video call, and I have
okay.
them bring a model with them. And we go through a very lengthy training, which is about 30 to 45 minutes. And then on top of the 30 to 45 minutes, I walk them through and have them actually do a treatment on their model. So I can show them essentially on myself, but also allowing them to play with it and giving them feedback. So they point the camera at their model while they're doing the treatment after we've walked through it. And then I give them feedback as they're doing the treatment.
So I've actually had, like I said, I've had the treatment done a couple of times, and I've actually seen the treatment done a few times. And my gut is telling me that the large majority of the estheticians that go through that training are like, this is the easiest device I've ever used.
They think it's too
It,
easy
it,
sometimes. They feel like they're missing something.
Thank you, because you have an adjustment, you have a dial adjustment on the base, which you can play with, as I understand it, if I'm correct. And then it's just really understanding the pattern at which you apply the handpiece to the face.
Yep. And you don't have to overlap at all. You can just do small overlaps, but a lot of times with like microneedling, you do side to side, up and down, and then you keep moving it side to side, up and down, or you do your circles on top of that. And so that's not something that you have to do with EpiStep. You just do the one pass along those each areas, and you're good to go.
And can I ask you a favor? If can you
Mhm.
stop sharing your screen for 1 second? I
Yes.
just we're gonna have we're gonna continue conversation, and I just want people to be able to see us when they're watching this on the replay. My question is, uh, there's somebody in the Q&A who wants to know how much the device is, and I'm sure that you guys are going to want to have that conversation offline, so we can just say to the person asking that, you can email Jason directly, and I'm sure he'll get you information on pricing. But I want to talk about two things. The first is, how do you market this epifusion treatment or the performance tip chemical peel to the client slash patient? And how much do you charge? And what can estheticians look for? Because I think that the device is amazing and the Epifusion facial is amazing, but I think they need some guidance as to, how do I add this to my menu? What do I tell the clients it's going to give them? And what are they going to be able to expect? So can we talk about that for a little bit?
Yeah, absolutely. So I love this as an advanced modality. So if you don't currently have any advanced modalities in your practice, we give you a ton of marketing material that you can use to put on your social media, to do on your website, to talk about this. And so I always market this as an advanced modality. And when I brought this into my treatment room almost 3 years ago myself, when I found it at the show before I started working for EpiStep, I was just a customer. I was blown away. I was in Sacramento. I met Jennifer, who's my mentor at EpiStep, and she was doing non-invasive wrinkle reduction, getting results without using needles, which to me, I was just blown away by. Like the before and afters that we have for our non-invasive wrinkle reduction are just mind-blowing to me. So I was drawn in by that, but also coming from another state, I moved to California from another state where I could do microneedling. And so I moved to California, and then I couldn't use a lancet. I couldn't do microneedling. I couldn't do any of these advanced modalities that I still wanted to be able to do. And I was very limited. And so to come across a device that gave the results of microneedling without the downtime, I thought that that was amazing. And a lot of times that's what I use as marketing for my new clients is like, it's an advanced modality. It gives advanced results with little to no downtime, no pain, and you don't have to worry about any of that. So we have lots of marketing material that we can supply to these accounts so that they can introduce it to their clients, um, and allow them to see what it does and what it is and why it works so well.
And do you talk to them about like the benefits of the treatment really being the fine line reduction, the plumping and the glow? Is that where you is that your like go-to selling attribute of the treatment?
It's so for me, I focus a lot on acne, and so for my clients, I really like this for the scar reduction. So if someone has had really bad acne and they have the really bad hypertrophic or keloid scarring or any kind of ice pick or box pick scarring, I always talk about that we can not only help them get clear with their skin, but then we can help them with the aftercare of making sure that they have that smooth, glowing, plump skin again that they want. Because that's one of the biggest bummers I feel like when you're treating acne is you get your client clear and then they have the leftover scarring and erythema and all these other things where they're like, okay, well, this is what now I want to move on to this next step of getting rid of that. And so how do I do that? Like we've cleared up my skin, we're on a good routine here. So that's what do we do next? What's the next thing? How do we get to the next step? Because you can get someone clear without this modality. By all means, there's so many good companies that get clients clear. And then what do we do after that when they have the leftover scarring and that's not clearing up? And what do we do with the post-inflammatory erythema? Like, how do we keep going? And that's what I think this device is good for. But on the flip side, for the anti-aging, absolutely plumper, firmer, brighter skin. That's what everybody wants. And so those tips can do that as well.
And this
That brought
is,
Oh,
go
go ahead,
ahead,
Bear.
Jen.
I was just going to say that brought up a good point when you said you treat a lot of acne patients. Do you use any of the other tips, like the hydrating tip? Will you use that on an active acne client and then transfer them into the performance advanced modality portion?
Yeah. I think
Yeah.
personally, and there's a lot of controversy in our industry right now about needling or channeling over active acne. I've taken a lot of classes on microneedling, and what I learned is that you can microneedle over active acne and you can get incredible results. And the thought process of spreading bacteria when you're doing microneedling over active acne is an old school thought process. So I just apply that knowledge that I learned when I got certified in microneedling to this and say I would 100% channel over active acne. I think it allows better product penetration for the treatment and for our hydrate tip. It's really great to minimize the downtime on a chemical peel or any kind of acne treatment that we're doing. It's just going to plump and hydrate the skin and prevent any kind of like flaking or downtime or redness or erythema. Same with the brightening tip. I would say if someone has active post-inflammatory erythema or hyperpigmentation, the brightening tip is a really great treatment tip to use in combination with other treatments to not only get them clear, but to actively brighten the skin and get rid of that erythema while you're doing that treatment or that hyperpigmentation while you're doing your treatment and hydrating at the same time.
That's what led me to think that, because so oftentimes your acne patients are so dehydrated and they're so stripped and they come in and they've been trying all of these things, and it's like you need to build that back up, that barrier back up before you start going in. So the EpiPen to me is just a no-brainer to incorporate. So love that.
Yeah, I would absolutely start with this before I even did, especially if their barriers compromised and we know that they're coming in with those dry barriers, those compromised barriers. I would absolutely do the EpiStep first
Yeah.
to rebuild their barrier back up before I started doing any kind of acne treatment. 100%.
All right, you guys. I also want to like chime in. We have a lot going on in the chat and the Q&A. First of all, Gloria's asking questions in the chat. Gloria, my love. You have to put them in the Q&A so he gets the information. So Gloria is asking how much the device is. So Gloria, you're gonna have to email Jason, and he'll get you pricing information. Then she wants to know, you guys are at the New York show, the B Plus Well, formerly IECSC event.
I'm so excited. Yes, we'll be at New York. I will be at New York. You'll see me. It's me. I'm the one.
Okay, perfect. So you're good to go on that. Maybe you'll buy the device at the show. But remember that she saw us here, Jace. Okay.
I got you.
Sue T wants to know, which one is your favorite tip? The performance tip?
I mean, if you looked at my order history before I even started working for the company, the minute I started using that performance tip, I was just in love. Like the results that I got for myself when I used it on myself, and then I started getting it on clients, like I just kept on reaching for that one. So like for every one hydrate tip or every one brightening tip, I'll probably order 10 performance tips. Because I reach for it that much. That's my go-to. But every client is going to be different and every practice is going to be different. And so it really depends on what you're treating and how you're treating it. That's the tip that you're going to reach for. But I do use them in
And
combination. Jenny had a really good point. I use the hydrate tip and I'll use a performance tip in one treatment.
And I think somebody asked that question. Do you ever do, it was Catherine. Hi, Catherine. Thanks so much. Do you ever do more than one tip at a time? And you just answered that.
Yep.
Um,
Especially
and
if you're treating
then
neck and décolleté separately and you're using more of the melting tips, you're going to absolutely want to use a secondary tip and then add that on as like an additional like 20 or $30 add-on for an additional tip and just telling your client that like
Yeah.
quick.
what are the treatment costs for the tips per tip?
So the cost per treatment altogether, when you incorporate the epi essence, the peptides, the hyaluronic, the mask, and a tip, it's about 20 to $25.
Nice. And what do you normally charge for treatments?
Oh, that's a great question. You asked that earlier. Thank you, Barry. I charge between 165 and 180. I'm in Northern California, just for reference. Like I'm not in LA, I'm not in Hollywood, I'm not doing those types of treatments down in Southern California. And a lot of our accounts are in Southern California and charge much more. But I feel like in Northern California, 165, 175 for an advanced modality is a really good treatment. And again, if you're in a Medi Spa, that's a different setting. I am not a Medi Spa. I don't operate as a Medi Spa, but we have accounts in Northern California that are Medi Spa, and they actually use this as a step down treatment. So if they have an RN on staff that's doing microneedling, but they also have an esthetician, they'll do their microneedling up here at this price point, and then they'll do EpiStep at this price point, which is a step down, but the esthetician can perform that. The nurse can perform the microneedling up here, and then we have steps in treatment depending on what the client or the patient can afford. And then you just kind of go from there. So I think that you can kind of stack your treatment pricing with this and make it your own. But I would be happy to talk about pricing with anybody that has questions about how to price this out. But I think 150 minimum and then move up from
Brilliant. Brilliant. And then I have another question for both of you and Jenny. Um, the Epifusion facial, would like could you use the hydrating tip and bill it as a like event prep for the patient with like get that amazing fresh glow, and then it's safe to Jen, you feel comfortable putting like a little bit of a foundation or powder on after the Epistep treatment?
Absolutely. Yeah.
yeah.
And
Okay,
Yep.
the
perfect.
every result that I've ever done here and with various skincare lines incorporating on women with crow's feet, it's historically just been women for some reason. The crow's feet are almost gone. They are so plumped up, and I really like to go back and focus around this, especially if you're doing like a red carpet type treatment, right, Jason? They literally get filled in. And this is using you call them the melting tips. Did I hear you say that?
I
Yeah.
love that.
I never thought about it, but that's exactly what they do.
Yeah.
They don't
Yep.
dissolve, they melt. The
Yep.
melting tips, and they literally melt into this and they plump it up, and it's remarkable. So yeah, red
Yeah.
carpet.
Well, Jen, you said red carpet, and I think it's a great term, but I think like in bringing it down to like the everyday woman walk of life situation, it's do you have a special event for like one of your kids? Is it like an engagement party? Do you have a 40th birthday? Do you have a 50th birthday? Do you have a 10-year wedding anniversary? Like, are you going to a special dinner where you just want to look amazing? And, sometimes women come in and they want a treatment that's going to like give them a boost. They don't necessarily want to start an entire skincare routine. And so this would be like something that you could do for them, and just to give them that fresh glow when they walk out the door and head into that. So I that's why I love this treatment, because of what you just said. Like I always see it like, wow, like it's just your skin is woof, it's just full.
Yep.
Um,
I really love this for brides, the week of their wedding.
yes,
We got exactly.
yes.
There's
Such a
no
good treatment.
downtime ever.
And makeup artists love it when they go to do the makeup on that bride after they've had one of these facials done. Everything's plump and firm and smooth and hydrated. It's a no-brainer.
Yeah. And it's just like, because when you're putting on because brides usually have like, they have a layer of foundation and a layer of powder. And I'm sorry, no matter how good the powder is, if you're powdering skin that has a little bit of a crepe to it,
Mhm.
it just shows.
Yeah.
Yep.
So it's there. As we keep talking, more and more people are chiming. Simone, I'm saying that right, Kim. I hope if I said it wrong, let me know in the chat. How do we start at the neck with stamping?
So with if we're doing the actual neck area, like I always start, like I said, start at the top and work my way down. But if you're doing the performance tip, I just do downward motions this way until I get to the décolleté, and then I do a cross on the décolleté. That's what the performance tip. If you're using one of the melting tips, as I called it earlier, you're going to do the dry channeling first in the same direction, and then bring it down to the neck to do the dry channeling this way. And then again across the neck and décolleté if they want to do that. But then when it comes to the melting step, you're going to want to add on an additional tip. So we can do some really, I would say 2 to 3 treatment areas on the face with one tip during the melting phase. And then across the neck, like especially if we have tech neck. I love using the melting tips on tech neck because it's really great for plumping out those lines along this way. But essentially, one tip for the neck area and then one tip for the face area when it comes to the melting step.
Jen, you want to
And
get those last two on the
yeah,
Q&A?
that leads right into Catherine's question. How many stamps in one place do you do with the tip?
Yep. So again, we're just doing a very small overlapping along the face, and so starting in the top center here, and then working our way out. So if this is your treatment tip, essentially here, 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 bring it down here, 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 and that's about the size of a treatment tip. And so again, very little overlap is needed in order to get those channels going. But yeah, it's very. You'll be surprised at how quick your treatment
Yeah,
time is with the actual stamping and the melting because you cover such a large area in a small amount of time.
very efficient. Very, very efficient. And then Catherine's final question is, do you know of anyone in the Tampa Bay area I want to try before investing?
That's a great question. Catherine, email me. I know we have a lot of accounts in Florida. We have a lot of accounts in Florida. We actually go to the trade show there every year to make sure that we cover those accounts and that we're able to talk to them every year because we have so many. But yeah, email me and let me know or text me and remind me, and I will definitely get back to you and find you someone that's close to you so you can try it out.
Perfect. And
And
Kim,
then Kim's asking,
yeah,
go ahead,
she
Jen.
asked, which ones are the melting tips? So you want
Yep.
to differentiate?
So the hydrate and the brightening are the melting tips. Those are the ones that are made out of hyaluronic acid, and so those ones will melt into the skin when activated with any kind of liquid, water, hyaluronic acid serum. So brightening and hydrate are the two tips that melt, and then our performance tip is the last one, and that one is made out of the polylactic acid. Polylactic acid again is that it's a biodegradable plastic that does not melt. And I've actually been testing this on myself. I have a performance tip that I've been using on myself for almost 2 years now to try to just keep using it to see if when it's going to
Wow.
actually break down. Like I'm waiting for it to break down to see where it's not going to actually function anymore. And again, I'm not recommending that you reuse these tips, but I just for my own purposes, I want to see how long one of these tips lasts before it breaks down on me. And I'm just doing it on myself as a test because I'm super curious.
Mm-hmm. And
Hysterical. I love
still going
that.
strong.
Um, wow. So this was awesome. The more we let to look, the more we get to know this device, I feel like the better we're prepared when we come into these types of educational opportunities because we're really able to come up with even more interesting points of conversation. And, the thing that I love even more now is that this is a seriously clinically effective device with the performance tip and the chemical peels, but it also, like, the device can be used in your business in so many different ways that it just every different way that we choose to use it in the business increases the revenue that you can generate from it. So the
Yeah.
same patient that really needs the device for serious correction after, clearing up acne is different than the patient who's getting married and wants the glow, or the woman who's turning 40 and wants to go to her 40th birthday and look phenomenal.
Mhm.
So it just has so many different places it can fit. And I think it's great. You did a great job, Jason. Thank you so much.
Thank
Any final
you.
thoughts from you, Miss Jen?
I am just thrilled. I mean, we've loved this device for the past, I get 3 years, Barry, four, three,
I can't
um,
remember.
since we first met it, and it was, a whole new concept in the industry.
Five. Five.
So
Because
I'm aging myself.
I got my first treatment from Jennifer when I moved here in Fort Lauderdale in 2021.
Okay.
I
Wow.
mean, and look how
Yeah.
far it's come. Now we're incorporating peels. I just love it. So
And
Jason.
then I hate to close it out. I'm sorry, we can't close it out yet because Kim asked an amazing question. Is any numbing required?
No.
That question to me, Kim, is hysterical because it's the most gentle treatment. It's like you can fall asleep.
A lot of people do
Nothing.
fall asleep when they're getting the treatment, which I think is hilarious because
Because
that
it's the vibration.
Yeah.
Anytime there's sound and vibration, I'm like out like a light. So yeah, absolutely. It's a pleasure to receive. The results are phenomenal. You're gonna love it. Um, wow. Okay, so we'll do this one more time. Jason, thank you so much for joining us and all
Thank
of that
you.
incredible information. Jen, any finals on you? Good to go. All right, you guys, thank you. If you joined us live today, we love you. We thank you. We appreciate you. If you chimed in the questions in the chat, you make it so much more fun because it's interactive. If you registered and know that you're getting this on the replay, we love you for registering. But if you are going to wait until March of 2026 until this is live on the website and you're watching it at lipglossandaftershave.com, keep going, you guys. Lots more to learn. Take care. Have a great day.
Good day, guys.
Bye. Thank you.